Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Dan Muntean. He's a family physician. Today's Kevin MD article is The Heart of Family Medicine, a doctor's journey of compassion and care. Dan, welcome to the show.
Thank you, Kevin. Good to be with you.
All right. So tell us what led you to write your article on Kevin MD in the first place.
It's an interesting story. I was like a physician for 30 years and I have a hip replacement. And it was for the first time in the life when I stay at home for 1 month. And I have sometimes to reflect. And I was having time to read books, read articles. And it was an interesting thing about, it comes to me how I want a family physician to be in 2025 after a lifetime experience. What is the future of family medicine? How you see a family doctor, in today world with artificial intelligence, with a lot of specialty, and what's the place of the family physician? I was thinking that it's important to set some boundaries and to find out where's the future is for the new generation.
Okay. So tell us what your article is about for those who didn't get a chance to read it.
It was about a little bit of history about my mom. She was the chief of the hospital. She was working for 40 years, trained me like a physician. I start after that to explain about responsibilities of being a family physician and how I see how a family physician should be regarding the compassion, about the joy to practice medicine. I think that one, it was about the joy to practice medicine. There are a lot of people that they enjoy this profession, and I'm one of them. I go to work and I'm pleased to see my patients, and I'm happy when I'm working. That one, it was in a nutshell.
So tell us what your practice is like.
I practice in Surfside. I see around 25 to 30 patients a day, and I'm fortunately to have those patients, some of them for 20 years, and we develop an incredible good relations. Is like I call my patients my people. I know everything about them and they know everything about me. It's not my patient is not a number. I know everything about their social lifestyle, their struggles, their medication, and I'm a strong believer in the human touch. It's the medicine. It's about not only about professional, it's about the human touch, to give them a little bit more than 15 minutes of your time.
Now, do you practice by yourself or do you practice with partners or in a large group?
We are practicing, we are part of a good corporation, Conway Medical Center, and we are like 15 satellites clinic. And in my office is me, one doctor, and a physician assistant, a very good group.
Now, when you say that you want to practice medicine with the human touch, as you know, there's a lot of obstacles that prevent doctors from giving that human touch in the exam room, right? So how do you maintain that humanity in practicing medicine when it's so difficult to do so today?
That one, it was like the main issue of the article, because sometimes you are forced in the 15 minutes to address a lot of problem, you are on the fast track. You have to address a lot of parameters, a lot of points that you have to touch, but sometimes you forget about to address the people regarding how well they are feeling, what's their perspective about medicine. Patients have a totally different perspective about how they feel than about how the doctor thinks that they feel. It's important to see from the patient's perspective, not from the doctor's perspective. Sometimes the number looks great, but the patient is not doing great. And you need to address that problems. Sometimes when all the numbers are perfect, sometimes the patient is not well, and you need to address that one. You need to see how I can make him to feel better, not just the numbers.
That was a saying that I was taught very early on. When you're talking to patients, you have to treat the patient and not the number, right?
Correct. Yeah, that one, it's very easy to say just treat the patient, but it takes sometimes a life experience and human touch. It's like to develop the social skills to see, because everybody is different from a different social background, different comprehension about medicine, different opening about the physician. And you establish this one not in 15 minutes. You establish after spending probably 10 years of practicing with the same patients, and they feel comfortable, they open to you, and after that it's a bond. They create a bond. And this one, we all the time said patients doctor relationship is the most important, but it's easy to say it on the sentence, very difficult to achieve.
Mm-hmm. Now, you've been practicing medicine for 30 plus years now. What kind of advice do you have for the medical students who may be listening to you now, or some of the new physicians who may be just becoming new attendings? What kind of advice and wisdom can you share with them?
To get more qualified in all the aspects of the medicine, I train students in my office from Campbell Universities, and I'm fortunately to have 6 students a year. Every month I have a different students, and I teach them and I explain them. You do not want to be boxed in small things and you cannot practice because you don't have the knowledge. You need to develop the knowledge in all the aspects of the medicine, in all the complexity. Sometimes you need to do pain management. Sometimes you need to do psychiatry. Sometimes you need to do complex cases of cardiology and pulmonologist, and you need to accumulate all the knowledge. Don't depend on the specialist, because sometimes the specialists are not available so easy. They are available, but you need to wait 5-6 months, and you need to be comfortable to take care of all the patient and all the problems. Yes, the input from the specialist is very important. We are part of the team, but I have my expression, the family medicine is the quarterback of the team, is the captain. You will have all those people that are very important in the healthcare of your patients, but you are in charge. You'll make the main decision. You'll have easy access. And this one, it's important. Sometimes the patients, they are not able to see the cardiologist for 5 months. You'll be able to see him in 2 days, and you'll need to address the problem. This one is just get competent in multiple area and practice whatever you will choose in the future will be very helpful.
Now, as you know, there's a primary care shortage in our country today, and a lot of medical students are actually not choosing family medicine and primary care and going into specialties. Tell us some of the joys of primary care and why you love primary care, and maybe inspire some of the students who may be listening to you now.
I'm telling you, it's like they have the sensation that the primary care is just like a non-important person. I'm an expert in family medicine. I have 2 specialties. I'm specialist in primary care, and I have the joy to practice medicine because I'm feeling comfortable to treat all those problems. And I can treat like probably 90% of the problems on the patients that I encounter. And it's creating a bond that is not creating with any other specialist. They go, and sometimes medicine is complex. They will see a cardiologist, a rheumatologist, an endocrinologist, and you. But they know you the most. You see them the most. You know everything about them. They come and they will say, "Hey, I was to that cardiologist. What do you think? What's happening with me?" And you need to translate the medical terms in their language. And they are, I think, the primary care have the most joy of practicing medicine. If you take the financial aspect, I think joy to practice medicine, it's in family medicine. Sometimes, and I'm sure in the future, the financial aspect will catch up. Right now, it's a gap between the specialist and primary care. But when you close up that gap, you'll be happy to be a family medicine. It's like, I don't know, I feel comfortable. I go to the clinic, I was happy today. I come from the clinic, I'm happy practicing medicine. And this one is like, I all the time tell to the patient the joy of practicing. You know what the patients want, what the patient wants from a doctor. You know, patients are a little bit apprehensive. They go to the doctor, they feel uncomfortable, they go in a different environment. No, when come to me, they know who I am, they know that they will be relaxed and they'll be well taken care of. Yeah, this one is joy of practicing, and to be positive in your practice. That one, it's very important.
Well, I think your perspective is certainly wonderful to hear. I talk to a lot of physicians that actually don't have that joy of practicing, and just it's so difficult to kind of maintain that physician-patient bond in the exam room when there are so many obstacles and challenges that try to break that bond. Now, you've been practicing, like I said, for 30 plus years. Give us some tips in the exam room on how to strengthen that bond you have with patients when there's so many outside forces that chips away at it.
Yes, it's like all the time I try to explain, we are living in a world when we are slave of the computers and documentation. And most of the new doctors, they look at the computer, they type, their notes look extraordinarily well, but they don't have the bond. I try to talk with the patient. I have examined the patient. I listen to them. And sometimes I make the note half before and half at the end. But during my communication with the patients, the 15 minutes, they have my attention. I do my physical exam. I touch every patient. I examine everything. I have the human level interaction with them on and off. I ask them what's happening with them. And I have a very good team. You know, I have a very good team. The nurses collect the information. It's not necessary to repeat 90% of whatever we've done. I take some touch and I do some modification, but it's important to look them in the eyes, to listen to them, to examine to them, and documentation and computers are important, but you can do both.
We're talking to Dan Muntean. He's a family physician. Today's Kevin MD article is The Heart of Family Medicine, a doctor's journey of compassion and care. Dan, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yeah, I try to explain. I think the primary care medicine is vital for our healthcare. And in the future, we will be still the most important part of the medicine. We'll have all the access to all the specialists and we'll get all the access to technology. But it's important to coordinate all the care of the family medicine and to keep the bulk of the medicine in the primary care and to be able to help the patients to navigate through the cost, through the test, and to understand, to educate the patients about modern test and technology. That one is a challenge that can be achieved through education.
Dan, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you very much.